My name is Coleman Coker, and I did my speech today on chronic traumatic encephalopathy. My general purpose today is to inform the audience, and my specific purpose is that the audience will know more about the symptoms of chronic traumatic encephalopathy. Chronic traumatic encephalopathy is a degenerative disease caused by a person having multiple concussions or traumatic brain damage. So 345 out of 376 NFL players have been affected by CTE. Chronic traumatic encephalopathy is a degenerative disease caused by a person having multiple concussions or head trauma. According to the Concussion Legacy Foundation, CTE is a degenerative disease that is found mostly in former athletes and veterans. This is due to an extensive amount of brain trauma. A person living with this degenerative disease suffers from cognitive impairment, behavioral changes, mood disorders, and motor symptoms. These symptoms can cause a person that had a healthy, normal life to become depressed, have problems with walking, impulsive behavior, memory loss. What are the symptoms of chronic traumatic encephalopathy? According to the Mayo Clinic, chronic traumatic encephalopathy can only be diagnosed after death. The reason for this is because the only way to diagnose the disease is to have evidence of degeneration of brain tissue and deposits of tau and other proteins in the brain. However, throughout a person's life, they can experience symptoms such as cognitive symptoms that include memory loss, confusion, impaired judgment, and a difficult time thinking. They become challenged with small tasks, which makes it harder to focus on what is at hand. For example, some people with CTE have memory loss. This may affect someone with CTE while they are driving, as they can get lost, forget where they are supposed to go, or even cause them to wreck. Behavioral changes that interferes with the life of a person with CTE. They may see changes in their behavior causing violent outbursts. For example, a person with CTE may say vulgar and inappropriate words at a person with no reason behind it. A person experiencing CTE can also randomly become aggressive while being around family, in a grocery store, and while driving. In a study constructed, it showed that out of 52 confirmed cases studied, 30% showed prominent mood disorders. Behavioral changes associated with CTE after autopsy are consistent with degeneration in the amygdala, a major center for processing emotions in the brain, and orbitofrontal, a part of the brain that has extensive connection with the sensory areas that are involved in emotion and memory part of the brain. Mood disorders that sometimes make a person with CTE hard to be around. People with CTE may experience depression, anxiety, and can be suicidal. Doctors can prescribe certain medication to people with CTE to help with these symptoms. Doctors can also advise CTE patients to sign up for cognitive behavioral therapy, or CBT, and other forms of counseling to help process their emotions, develop coping strategies, and help improve their overall mental health. Out of 51 cases of CTE, 30% of cases showed mood disturbance. Of those, 30% and 28% were associated with depression. Mood changes can be associated with amygdala degeneration in the brain. Motor symptoms that make it hard for a person with CTE to have conversations. People with CTE can experience tremors. These are when a person shakes uncontrollably, particularly in their hands. They also might experience dystonia, where a person's muscles contract uncontrollably, leading to abnormal movements. For example, you may be talking to a person with CTE and start to notice them shaking and moving uncontrollably. Most doctors put their patients through physical therapy to help the person learn how to control these movements. A doctor might also give their patients canes or a walker if these movements demonstrate that the person needs help walking. Today we learned about the symptoms of chronic traumatic encephalopathy. Chronic traumatic encephalopathy is a degenerative disease caused by a person having multiple concussions or head injuries. 345 out of 376 NFL players have been affected by CTE. Symptoms of this disease include cognitive symptoms, behavioral symptoms, mood disorders, and motor symptoms. Although it is an incurable disease, there are ways to help treat it and improve life for people with the disease.